Now, what I want to get to next is what a lot of the audience wants to hear about is anxiety.
Yeah.
What is anxiety? How do you assess anxiety? How does anxiety manifest, whether it's cognitively, somatically?
Yeah.
And perhaps what are some tools you utilize with your patients so they can get in touch with what's making them feel anxious? Hey, doc, I'm feeling so anxious. I have no idea why. And perhaps how they can get more insight into themselves to feel less anxious. So let's dive into anxiety from an ISTDP or from your perspective.
Yeah. Hopefully we can get through all that. That sounds...
We have a lot to talk about. We have plenty of time. Yeah.
So I'm going to try to keep it all in mind. But what I want to say, you bring up anxiety. We've talked about feelings. We've talked about defenses. And now you bring up anxiety. We've actually just completed one of the core concepts of ISTDP, which is the triangle of conflict.
The triangle of conflict.
Yeah, this was first outlined by a psychoanalyst named David Mallon, who was from the UK. And he worked with the guy who sort of organized ISTDP named Avenue. But he came with this idea of two triangles that you can use to guide your work in therapy. And one of those triangles is called the triangle of conflict. The triangle of conflict has 3 corners. And these are different positions that the person might be taking in actual real time in the room with you, you know? So at the bottom of the triangle, this is the core, the center of the person. This is the natural impulse that a person feels, you know? So if they have like a happy feeling and the impulse is to smile and play and be joyful, then that's
the natural state.
Impulse.
Core impulse is one side of this triangle.
Yep. So you got the core impulse at the bottom, or the feeling. And then on one corner, you've got the defense. That's the thing that the person does to avoid having that feeling, to avoid experiencing the impulse, to try to redirect it, right? So that's the defense. And then on the other corner of the triangle is anxiety. Anxiety is the core part of the triangle. It's called the triangle of conflict because this is the set of things that a patient might do if a conflicting feeling comes up. We've talked about having conflict over anger, and that makes sense because there can be bad outcomes if someone acts out their anger, right? But there's also conflict over sad feelings and happy feelings, depending on how the patient, what their upbringing was like. So when a feeling comes up that you have conflict with, then what do? You try to make that feeling go away by doing something defensive, right? But why do you do that? Well, because when you have the conflict, the experience of the conflict is distressing, right? It is distressing. And distress is felt in the body. It's physically it's in here, it's in here somewhere. And that we call that distress anxiety in ISTDP. We're not talking about anxiety like classical, generalized anxiety disorder, check these boxes and now this is what anxiety is. We're talking about the actual visceral experience of distress that you have.
And what does it feel like? What does anxiety feel like in your body? How can it manifest physically? I know it's different for different people, but how does it feel like and how can it manifest?
So that's an important thing to note, is that it's different for different people.
And also I know that you recognize that, sorry to interrupt, is that you do an anxiety assessment.
Absolutely.
Because you can tell how severe someone's anxiety is based on the physical symptoms that arise from that anxiety. So perhaps we can go through that in anxiety assessment, how it's manifesting physically, and what that tells you as a provider as to how severe this anxiety is.
This is super important in ISTDP because it's intense. You really need to be monitoring with the patient. Hopefully they can monitor with you, but it's on you to kind of lead the way. You need to be monitoring how much anxiety they're getting because you don't want them to go over threshold.
Of course.
But also you don't want them to have no anxiety, because if there's no anxiety, then there's no change, right? So anxiety is experienced. The way you teach about anxiety in ISTDP is you think about it in 3 different levels, okay? The lowest level, which is the level where you can actually work and make change, and it's distressing enough that you want to fix something, but not so distressing that you're overwhelmed. This is anxiety that's felt in the muscles of the body. Like when you think about muscles, just the normal thing that an average person in society would think of muscles, the muscles in the hands, the muscles in the legs, the muscles in the chest. If a person takes a big sigh, That's movement.
I'm tense in my shoulders. I'm tense in my neck.
You're holding it up in there. You can see their shoulders are high.
So this is level 1 anxiety.
This is level 1.
This is where you want people to be during therapy, because being a little bit anxious during therapy is helpful for the process of making change.
Yeah.
And this is the anxiety felt in your muscles. Is it the muscles that we're familiar with?
The
right?
muscles
like you just described.
Any muscle that you can voluntarily move in your body.
Your skeletal muscles.
Your skeletal muscles. Any of those muscles, that's anxiety. That's okay to work with.
Okay
right?
to work
that's
with.
That's a good level of anxiety
level.
for therapeutic work.
Yes.
You know, and so the next level of anxiety is anxiety that's felt kind of in you can think of it as in the organs or in the muscles that you don't have control over, if you look at it from a more medical standpoint.
Your autonomic nervous system.
Yeah, you're thinking like the muscle, they're thinking the tightness in
Smooth
your blood
muscles,
pressure.
yes.
It could be like you get higher blood pressure. You could get like cramping in your stomach, you know, maybe some diarrhea or some nausea. You could have that. That's a way that could happen. Anxiety that's in those muscles, if your therapist is asking you, how did you feel towards your partner, you know, when they yelled at you, and then, you know, you don't feel any of the heat of anger, and instead you just feel nauseous. Well, that's a lot of anxiety, and that's too much. You don't want to work with that, because that's saying that the anxiety is the problem then, and you want to try to lower the anxiety before you can get back to dealing with the feelings.
Yeah. So that's too much. Now, just a quick 2 sentences, like irritable bowel syndrome, IBS.
Yeah.
A lot of the times that's secondary to anxiety.
Yeah.
Now, can you connect it with what you just said?
There are a number of ISTDP providers who are doing research on this, I believe, right now.
As far as irritable bowel syndrome, I hear some ISTDP providers even saying that ulcerative colitis can be secondary to an anxiety manifestation in your smooth muscles, which I believe is what you are describing. But, well, what do you think about that?
I've heard people say that too. My personal thoughts, I mean, for irritable bowel syndrome, classically it's a functional disorder, which means that you don't see anything on any of the scans or any of the tests. Like there's nothing that they can see that's physically causing it. So I tend to think that is most likely entirely caused by, you know, anxiety that's gone over threshold.
I do
People
too.
who are not able to really, like, for whatever, it's not their fault, right? But whatever they get over threshold when they get feelings, you know? And I actually had to pay when I was in training, one of my first patients that I was working with was a person who had very serious like IBS, and like when he would take tests and things, like it was really, he was having a trouble in school because he'd go in for like, you know, like a calculus test or something. And then he would just get a rush of diarrhea, and he'd have to like bail from the calculus test and run to the bathroom if he didn't want to have an accident, because it was just so intense, you know. And he was clearly getting anxious. It was about like performance, about competition, you know, and it's about he had some conflict over, you know, success and failure, like that sort of thing. He needed to be rigid and perfect. And so this was a way that his body was fighting back and being like, look, you can't be perfect, you know. I
have seen the same. I have seen absolutely cases of patients that get sent to me from their gastrointestinal doctor because they have IBS. They think it's from a psychological cause. I do an anxiety assessment. I get to know the patient. We treat the root cause of their anxiety, and their IBS improves. Now, so you've discussed that first level of anxiety where it discharges into your skeletal muscles. That's good. We want to work with it. Fine. We've talked about the more severe second step where your anxiety is being discharged into your smooth muscles. Too much. Not something we want to work with. We'll work on reducing that anxiety.
And then
now the third level.
This is going to sound familiar to a lot of people. You know, there's a lot of talk I hear about like dissociation and things like that. That's the third level. This is anxiety that gets into the mind. Like you're so anxious that you can't discharge it just by shaking it out in your muscles. You can't just tap your foot and then you're calm. You can't pace and then you're calm. You're so anxious that you can't even like have a bowel movement, and then that's going to relax you. It's not just a headache. Now it's your entire mind just goes, you know, there's a number of things. Maybe you'll get
perceptual
changes. You'll get tunnel vision. Maybe like you just won't be able to focus. You'll be looking at something. You'll feel like things get really far away, even though they're not really. There's no distance change. You get like a floaty feeling. It's harder for you to track a conversation. Some people when they go, you know, if they have like performance issues in school. Let's say that they do just fine on homework where they can go home and, open book, be careful, think about it, come up with good answers. But then they have to go perform and go do the test in real time, and it's much harder for them. Yeah. This is a high level of anxiety.
Performance anxiety.
Yeah.
And this is what you also have to rule out. Quick note. ADHD patients that come to me that are anxious, you have to rule out that the anxiety is not cognitively impacting the person to the point of causing attention and concentration issues that mimics ADHD. So first level, second level, the third level is perceptual changes, dissociative. I'll tell patients, some people can be so anxious that they will get lost, walk from their bedroom to their bathroom.
Absolutely.
Their short-term working memory.
Yeah.
This is severe. What do you do with this? When you see this, what does this tell you?
Well, no, originally when ISCDP was developed, actually, a lot of providers would say if the patient is regularly going into, cognitive perceptual disruption is the term that we use for it. If the patient's regularly having that high of an anxiety and it's just overwhelming them, originally they would say, well, I don't know if you can really do this therapy, because we're going to be pressing for feelings and then you're going to spike up and then that's not going to work. But in more recent years, there's a fellow, a doctor named Alan Abbas, who's up in Canada, and he's been doing really great research and really great work. He's worked with a lot of people who have dissociative disorders and who are, you can think of it like that it's a very fragile tightrope they walk where a feeling comes up and then they immediately go over threshold into just like overwhelming cognitive anxiety. And so he's developing a way to really kind of be sort of very gently like kind of help bring down the anxiety to a more tolerable level, and then introduce the feeling approach the feeling together with the patient just gently, and then watching to see it go over threshold again.
What does over threshold mean? Will you explain to the audience? What does it mean when anxiety is over threshold the way you're using it?
So the threshold is just after that first level of anxiety. From level 1 to level 2, that's the threshold.
The threshold for what?
The threshold for now, you don't want to be pushing for more feelings.
Yes. So the threshold that in therapy, as a provider, if you see the patient's anxiety rising past this threshold, you are no longer pushing in and challenging. At that point, you're working with the patient to regulate their anxiety, to bring it back down to stage 1, because that is where the productive work can happen. If I have a patient sitting in front of me and I'm pushing them and we're bringing up feelings that they have a lot of conflict about, and they start telling me, hey doc, I'm getting like nauseated, or my ears are ringing, I'm now switching gears. I'm not pushing, I'm not challenging, I'm not inquiring, I'm done with the incisive questions there. We're now regulating their anxiety to bring them back to stage 1 where we can do productive work. A question for you: when you have patients in session that go above threshold, how do you regulate their anxiety? Now, everybody watching these, perhaps you could learn how to regulate your own anxiety when you're feeling very anxious. Maybe that is a lesson here. How do you regulate the anxiety of a patient real time in clinic with you and bring them down to level 1? How do you do that?
Well, so the first step is to slow down and take a pause, because whatever it is that's happening that's bringing up the feeling is something that you're actively doing. So you want to stop doing that.
So take a pause in the work.
Immediately take a pause in the work, right? Then the next thing you want to do is you want to start actually paying attention to your body, because you say there's something very, we call it grounding, There's something very settling about being able to notice what is actually happening in your body.
So you get the patient in tune with their body.
Yeah.
Yes.
And you can do that through it. One of the simple things to do is you can just do a simple body scan. You'd be like, I think I'm feeling a lot of anxiety. I think I'm overwhelmed. Like, where am I feeling the anxiety? And just start from the top and go to the bottom. Start from the bottom, go to the top, do it in an organized fashion. And then the order will provide you a scaffolding that you can lean on while you're, overwhelmed with your anxiety. You can start with your feet. Say, do my feet feel, am I squeezing my feet? Are my feet relaxed? Are they tight? Is there a buzzing feeling in my feet?
How does this help them feel less anxious? scanning their body like this?
Well, it's because it's them getting in tune and paying attention to them. The anxiety is a signal that you're in distress, you know? And when you're in distress, you want someone to pay attention to you and care about you. And at the very base, you know, you can always pay attention and take care of yourself. And this is you doing that. It's offering yourself, a little bit of an olive branch, a bit of support, you know, giving yourself a little bit of care.
And what I have found is that when we're feeling in that really heightened anxious state, people get very fearful, like there's something going on with them that's dangerous. So when you bring them back to reality, this is what's happening. You're feeling very anxious. The sensations as we scan through your body are manifestations of anxiety. You're not having a stroke. You're not having a heart attack. Regulating breathing. I mean, that's almost step one for me, is like the breathing regulation. So here we're getting in touch with their body, the body scan, the breathing. What else do you do to kind of bring them down from their anxiety?
So there's three classical things that they usually think about in ISTDP. The deep breathing is one of them. It's easy to start with, right? Anyone can learn how to do deep breathing. There's a practice to it, right? It's about learning to relax your abdomen and relax your diaphragm to have it really pull deep, you know? There's the body scan, right? Which is where you pay attention to your body and you really try to notice what's happening there and actually care about what's going on inside your body. And then to really also experience it, you know, because the more you pay attention to it, the less overwhelming it's going to seem. If you've got just tightness everywhere and nausea and cramping and your mind's scattered and you're not paying attention to it, you know, it feels incredibly overwhelming. But when you notice it, you can catalog it. Now it's more understandable. It's not overwhelming anymore. It's manageable.
Absolutely. Right? Don't avoid the fear response.
Right. Understand it.
Understand it.
Yeah. So that's the second one. And then the third thing is, you can always change the subject, you know, go back to something that was comforting and calm, you know? So, I mean, people, if you're by yourself and you're having like an anxiety attack, you can do things that what they'll oftentimes recommend is having a list of things that usually are relaxing for you, you know? If there's music that you like to listen to, or if you like journaling, you know? Changing the subject is you know, because it's the subject, it's your conflict, it's your conflictual reaction to the feelings that come up in the subject that are causing you, that you're having anxiety about. So if you change the subject, then there's nothing to have anxiety about and it should fade.